the carpal bones. And so this image that we're looking at here is showing the right hand for reference. So here's a palmar view or a view from the palm, and here's a dorsal view or a view from the back of the hand. And so we've got these two rows of bones, one in front, the other. So we'll start with the more proximal row. We'll start from lateral to medial, and then we'll look at the distal row. So the proximal row starts with the scaphoid, most laterally, so in line with the radius. So we start with the scaphoid, then we have the lunate, then we have the triquetrum, then we've got the pisiform. So scaphoid, lunate, triquetrum, and pisiform. And then for the second row of bones, the more distal row, we start with the trapezium, then we've got the trapezoid, then we've got the capitate, and then finally we have the hamate. A cool mnemonic that I have from my med school days that I even use to this day is "she looks too pretty, try to catch her." And that has helped me to kind of memorize this when I was in school trying to memorize this. So I think that may also be helpful for you to memorize this as well. So that's scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. She looks too pretty, try to catch her. Okay. And then very lastly, the very distal upper extremity bones are called the phalanges. We've got several rows of phalanges, and then those are bridged to the carpal bones via the metacarpals themselves. So we've got the two rows of carpal bones. We've got the metacarpals, which are basically the hand bones. Then we've got the proximal phalanges. We've got 1 through 5. We've got the intermediate phalanges. Now there's no intermediate phalange on the first digit or the thumb. So we've only got 4 intermediate phalanges. And then we've got 5 distal phalanges, which are the very distal tips of the fingers. Now let's move on to look at the lower extremity, starting with the lower extremity girdle or the hip girdle. And so we first look at the pelvis or the os coxae, and the pelvis is actually a fusion of 3 separate bones. There's the ilium, which is the entire top part of the hip bone. All of this is the ilium. There's the ischium, which is the posterior part of the hip bone. So all of this is the ischium. You're pretty much sitting on your ischium or your ischial tuberosity. So just bear that in mind for reference. And then we've got the pubis, which is the anterior inferior part of the hip bone. So the ilium, the pubis, the ilium, the ischium, and the pubis anterior. We'll first look at some of the shared features that are seen shared between all 3 of these bones, and then we'll look at some of the unique features to each of these bones. So shared features are going to be the greater sciatic notch. This is the greater sciatic notch here. So again, just looking at the posterior aspect of the hip bone, we can see this nice large notch, which eventually gets closed off with ligaments and is a passage for some important structures. This is called the greater sciatic notch. Then we've got the acetabulum. The acetabulum is synonymous with the glenoid cavity. This is the socket for the femur or the lower extremity long bone. And so we also see a ball and socket joint here that gives a lot of movement and mobility. And then we've got the obturator foramen. So the openings that are medial to the pubis. So here's the pubis itself. Here are the obturator foramen. And so these are the 3 shared features that we see common to all 3 of these bones. Let's now look at some unique features to the ilium, so that top part of the hip bone. And before we do that, I want you to be thinking about how the hip bones articulate. So this is only 1/2 of the hip bone that I'm holding up, but we've got another side here that's going to attach at the pubis and gives us 2 complete halves to the hip bone. And so we want to be thinking about that with the sacrum in the center, right? So remember, the sacrum is also articulating to both halves of the hip bone here. And this is where we have the axial to appendicular connection in the lower extremities. So features of the ilium are going to be the iliac crest, so the smooth, rounded top of the ilium is called the iliac crest. Then we've got the superior the posterior superior iliac spine. So if we're looking at the ilium, and we look at the posterior part of the ilium, there are two projections. There's a superior projection and an inferior projection. So this is the posterior superior iliac spine, and then inferior to that is the posterior inferior iliac spine. Likewise, if we look at the anterior part of the ilium, we've also got two projections here as well. So the superiormost projection is the anterior superior iliac spine, and then inferior to that, we've got the anterior inferior iliac spine. So anterior superior, anterior inferior, then we've got posterior superior and posterior inferior. We've also got the ala of the ilium. So the flat surface of the ilium is called the ala here. And then we also see the auricular surface of the ilium. So the auricular surface is going to be where the ilium actually articulates with the sacrum. So again, bearing that in mind, this is only one half of the hip bone. We've got the other half of the hip bone. And then in the middle, we've got the sacrum, which is a part of the axial skeleton that we talked about last week. Moving down to the ischium. So again, for reference here, looking at our entire hip bone, the top part is ilium. The bottom front part is pubis, and the bottom back part is ischium. So again, we're sitting on our ischial tuberosity, so to speak. So parts of the ischium are going to be the ischial spine, and the ischial spine is the inferior border of the greater sciatic notch. So if you remember the greater sciatic notch that we just talked about, the most inferior part of that is where we've got the ischial spine. Then we've got the lesser sciatic notch, which is inferior to the greater sciatic notch. Then we've got the ischial tuberosity. Again, so this is what's on the chair when you're sitting down, for lack of a better way to put it. So this is the ischial tuberosity. And then finally, we have the ischial ramus. And the ramus is just the connecting or bridging part that is encirculating the obturator foramen. So because the obturator foramen is a shared structure, only one part of the border of the obturator foramen is a part of the ischium, and that's going to be the ischial ramus. Moving on to the last part of the hip bone here, so the anteriormost part, which is called the pubis. Here we have the superior pubic ramus. So the superior pubic ramus, again, is the bridge that is surrounding the obturator foramen, but this part of it is on top and is a part of the pubis bone itself. We've also got the inferior pubic ramus. So we've got the superior pubic ramus, the inferior pubic ramus, parts of the pubis, and then the ischial ramus, part of the ischium. Lastly, we've got the symphyseal surface. So again, because the pubis has to articulate with the other half or the other pubis, both pubises have to articulate at the midline, we have the symphyseal surface, which represents that articulating surface. And then the pubic symphysis is what we call that very strong fibrocartilage joint where both halves of the pubis articulate, and there's a large amount of fibrocartilage in between, really reinforcing that joint, really making a strong connection between both halves of the hip bone, and certainly stabilizing the hip bone as we walk, as we lift the legs with the gait.